Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
Welcome back. Now today I'm gonna share another story with you, but I don't have images because that was, I totally forgot to take images. But anyhow, the story is also another young boy, this time is a boy, about 11 years old. And this young boy been from one place to another, from one hospital to another. They are coming from far, Quantity, I think, or in the southwest, but far. They don't have, let's say, very good health care. So they come to Buya, being a big city, to seek help. And been everywhere, done everything, the same story. The story with this boy is urinating blood. The urine always with blood, 11 years old. All the times, the urine is with blood. Every couple of months, the baby is anemic, the boy, is anemic, and we have to go for blood transfusion. That is the story of that boy. Nothing can help. They done everything possible. Nothing can stop that. I mean, they don't know what it is. So they do manage, the best way they can, but nothing has resolved. So this boy comes in, and I usually, usually I do something called an ultrasound. I scan the body, and you might have, an idea what this problem could be, but when you scan, your views might change and your thinking might change because you see inside the organs, you see inside the body. And when you see with a scan, you see a lot of things that can help you achieve the correct diagnosis. So, I cannot diagnose anybody without scanning them. It's right there on my right hand. I do the scanning myself and I look. So when I looked at this boy, okay, the kidney looks okay, no problem. I mean, when you scan, you see the structure, the anatomy of the kidney looks okay. The thickness of the cortex. You see, we have the kidney, we have 2 things that we look at with ultrasound. We have the cortex, which is the most important thing. And then we have something inside that is different color from outside, we call the medulla. So now, the cortex was normal thickening, so with ultrasound, when we evaluate the kidneys, 2 things we look at. Is there any stones? How is the cortex? Is it thick enough? Because when the cortex is thick enough, it tells me that the screening, the shifting, the clearing of all the toxins from the blood is being okay. Because the kidney function in the body is to filter out anything that's not supposed to be there. Among other things, of course, which is regulating potassium, regulating sodium, and hydrogen ion. So the kidney is very important for us, very important. And you can imagine how important the kidney is if you know somebody, a relative of yours or so, that does kidney dialysis, that they have to do kidney dialysis 3 times in a week. It's a painful process, and the patient is always bound to the town where the dialysis is taking place. It's very painful. Plus, the patient is no longer the same. The health is deteriorating. So a patient that has a good kidney is definitely not like a patient that has a bad kidney that has to go into dialysis. There is a lot of complication there. The way of living, the lifestyle has totally changed. Now, it's really bad. I do not wish it for anybody or hope anybody, any patient that go to kidney dialysis. And in previous sessions, we explained that taking those herbal, traditional medicine without knowing what you're taking is very dangerous. We have seen young people with kidney problems that has gone into dialysis, 20, 30. And so it's very young age, they have gone into dialysis because of what they have taken, not knowingly that this thing can cause really kidney failure. So, having said that, back to our story with that boy. The boy is urinating blood all the times. There is every time he urinates, there is blood in the urine. The boy has to do blood transfusion every couple of months because he runs anemic all the time. It makes a lot of sense. When I see blood in the urine, that means those red blood cells has broken down and the hemoglobin has been released into the urine, and that's what gives it the color, right? So we know there is a problem. We know that boy is losing blood in the urine. So how come after all this time from one place to another, the problem is still existing? Why? Because the diagnosis has not yet been established. And that's why I say ultrasound at the time of checking the patient is very important. Now, when I look at the bladder of this patient, I see something that is abnormal. First minute, I see something that is very abnormal that I have seen before and I can easily recognize. So I asked the patient, I asked the family, has this boy been close to rivers? Does he swim in rivers or fresh water? The father says no. But the boy says yes. So what comes to my mind? Schistosoma. What comes to my mind? Schistosoma. So this is the diagnosis has already been suggested in the first 1 minute after looking at the boy bladder with an ultrasound. So the boy has been swimming in fresh water, in rivers, and schistosoma very much living in the same, in fresh water rivers or fresh water in general. So schistosoma made its way from the sole of the foot, get into his system, and this is a complication of schistosoma. Schistosoma is a microbe now. Is a microbe that made it now. Schistosoma doesn't only affect the bladder, it can affect the GI system, it can affect the lungs, it can affect a lot of things. So, but what I have seen is what? I have seen some abnormality in the bladder. Because this schistosoma, when they grow too much, they can even block the bladder. The neck of the bladder where you urinate, it can be blocked. You will not be able to urinate anymore. So that was a happy case. We could recognize immediately after just, playing the ultrasound. So what would I do as a next step? We send the boy for urine analysis. Definitely we're going to see blood in the urine because that is the complaint. And looking for the schistosoma in the urine, which is very difficult really to see in the urine. We have seen something, and we suspected schistosoma, and guess what? The diagnosis was absolutely correct. So this boy suffered of what is called schistosomal glomerulonephritis. We have a kidney disease induced by the schistosoma that he gotten from swimming in fresh water. The case was identified, the medication was given, and the medication is very easy. It's a medication called praziquantel. We're not going to mention any drugs, but the medication was given. It's a very cheap medication, it's not expensive, and the problem was solved. And now the boy doesn't need to be blood transfused every 2-3 months because we killed what was causing the loss of blood. We killed the microbe that was causing the loss of blood, which it was a very easy case to recognize, but it took him a bit of time to reach to the correct diagnosis. And once the diagnosis is made, it's very easy to treat. Once I know what is wrong, the next step is very easy. We can just give small medication, repeat it every week for 4 weeks, and that's it. End of story. We give a little bit of steroids to correct the kidney, and a little bit of, I use this, is amazingly working for me and for my patients, and I have excellent results, is a gum called Arabic gum with frankincense gum mixed with few other things, okay? And everything is listed there. So it's not like you is unknown. No, everything is listed there. The most important components is Arabic gum and frankincense gum and that seal the kidney. So leaking protein from the kidney and leaking other epithelial cells from the kidney can be easily corrected with this gum. I think I have a picture of it. You know, it's very easy. I mean, look, it's Frankston gum with Arabic gum. That's it. And this is it. This is 7,000 for this bottle. 2 of them will correct the problem. Anybody out there with the creatinine up to 4, okay, 3, 2, anything that is above normal creatinine level for the kidney, this is it. Couple of bottles of this, and it will seal, it will heal, it will reverse the injury of the kidney immediately. But not for very high creatinine. Very high creatinine, you need to see a nephrologist for that, especially if there is high sodium or high potassium, because you know the kidneys is very dangerous. The kidney disease are very dangerous because it has to do with a condition called metabolic acidosis, meaning the kidney is failing to excrete the hydrogen ion. Then as a result, it being retained in the blood, causing the blood to be more acidic, and that is very deadly, very bad. So in this case, then we have to refer to a nephrologist. A nephrologist is a doctor that specializes only in kidney disease. But if the problem is not too big and creatinine up to 4, this gum here, this mix here, can bring it down to the normal value. We have very successful results with this mix, and is proven to be very effective. We have cases that been everywhere. Oh, creatinine is high, 3.5, kidney is failing. We give this, it reverses back the injury, and the kidney is now normal, and the function is absolutely normal. All the potassium, the sodium, the hydrogen ion, the chloride, everything is back to normal levels. So it's a very good thing to do, as long as the creatinine have not gone above 4. Gone above 4, that's a nephrologist there. We need to possibly go into dialysis. But if it's 3.5, 3, 4, we can bring it down to normal value only after 2 weeks of taking this gum. So this gum is really amazing. It's called Arabic gum. You can look it up online. It's called Frankston gum. You can look it up online. It has great value and has been tried, and it works amazingly. It reverses the kidney injury unbelievably fast, and it's amazing, and there's no side effect, and it works very good. So we have a lot of cases that we have brought the creatinine level from 4 to 1 or 1.2 or so, which is the normal value. We're not going to take much about the time about talking about the kidney, because the kidney is a very complicated issue, and we have what is called acid base, and it's not for the audience out there to understand, but in simple English, if your creatinine is up to 4, we have a very easy way to determine the kidney function by looking at the creatinine, the creatinine value. Normal creatinine value about 1. If the creatinine value goes to 2, that means we are working with 50% capacity of the kidney right now. If it goes to 3, we are at 75% functionality of the kidney. If it goes to 4, we basically have no functionality of the kidney. So there is other factors to consider when we talk about the kidney. The most important factor is the potassium level in the blood. The potassium is very high, and now we talk about other issue. Patient is putting out urine. Patient is not putting out urine. That's 2 different things that has to be discussed. But in general, we have to say that potassium is very good thing to consider when we're talking about kidney disease.